I live in a small town in North Carolina called Ellerby. During the summer months here, that's when everything starts to come alive. I love hanging out with my family, carefree. When the sun hits your face, you do feel sun-kissed. It makes your mood different. I really loved the sun, but that all changed when I found out I had skin cancer. For years and years, I've been wearing sunscreen. And I thought that I had protected everything that needed protecting. There was a little small spot on the right side of my cheek. It was itching. I went to the dermatologist and they did a biopsy, and that's when they officially told me that it was skin cancer. I kind of automatically had a stomach ache, felt anxious and altogether worried. I was taken back and like, wow, where did I go wrong? They then scheduled me for Mohs surgery, where they cut it out. I said, how many stitches is it? She said 15. I'm not really a crier, but it was all that I could do to get out of the doctor's office because I had had another spot on the side of my nose, so I also knew that I had another one to go through, and I was so anxious and scared. There was a lot of nights that I lost sleep. So I went to 5 different doctors for second opinions and third opinions. That's how I found out about image-guided superficial radiation therapy. When I went in, Brittany really made me feel at ease with the treatments.
I really saw myself in Allison. We have similar skin types, similar age. Allison? We both love being outside, and it was just really relatable. So the process for image-guided superficial radiation therapy starts with a consultation. We have to identify that the patient is appropriate candidate for the treatment modality. IG-SRT, it's the non-invasive treatment. There's no cutting, there's no stitching. It allows us to see how deep the lesion is and determine the appropriate X-ray energy that we use to localize and target the full cancerous area and spare as much healthy tissue as we can. Mohs surgery would be beneficial if a non-invasive approach like IG-SRT is not able to get as deep as we need to. But that's why it's really important to have a nice full consultation prior to getting started to have a fully informed consent about what both your surgical and non-surgical options are to see if you're a candidate. The second site that Allison had was also a non-melanoma skin cancer, which meant that she would be a candidate for IG-SRT.
I love Brittany. She walked me through every step and told me that I would have 20 treatments for 6 weeks.
Thank you. You're welcome.
The recovery from the SRT, it got a little red, and it did have a scab.
Thankfully for her, it worked.
Looks like they did quite a good job.
I'm still weary about being in the sun. I do skin checks with a dermatologist every 6 months. I think it'd be good if we could look at my arms today and my face, probably my ears. And see. I have had skin cancer twice on my face, and so it's always in the back of my mind. But I feel like I'm okay to be in the sun,
harmless spots there.
Protected with my sunscreen.
Hey, y'all!
It's not only a physical thing that you go through, it's mentally draining.
Watch out, Lake Hillary. We have arrived.
If this does ever happen again, I know that there are more options, and I'm grateful for them.